Welcome to Midlife Glory, a channel devoted to what life is like in your 40s. So I've been watching a lot of YouTube. In fact, YouTube's one of the most typical ways that I get any information or, um, not like information, but it's my entertainment channel. And of course, I have my favorites like everybody else. But one of the things that has been really coming up so frequently is a topic that I am heavily invested in, and I've found myself very recently more ardently participating in discussions online about it and everything. It's this idea of health, and particularly the movement that is called like healthy at every size or health at every size. This has come up all over the place, and it's controversial, and people talk about it. And I want to talk more about it because it piques my interest, both as someone who struggled with my weight my entire life and like what my body looks like in this world, but also as a sociologist, as it being a social movement that has come about with the intention of, it seems to me, kind of like taking back the idea of what healthy is for people who, it seems to me, never get to the actual place of like the conventional definition of healthy. So, that's maybe the fancy way of saying it. What it really is people of size claiming that they too can be healthy at the size they're at, which I think is so interesting. So, uh, I've been following this conversation so much. Um, for both of those reasons. And one of my favorite places to look to for controversial topics, just to see someone talk about them that I think is certainly educated, somewhat interesting, um, is Dr. Mike. Dr. Mike, uh, everybody knows because he's like very YouTube famous. And I appreciate his take on everything because he is a conventionally trained medical doctor. Um, but he also is willing to reconsider what he has been taught. And if it seems to be awry, um, or if he can prove it to be not perfect, he will embrace other explanations for what may be causing disease or how to better treat patients or whatever. I see him as a very kind of open mind in what is a very traditional and often kind of like policed space, right? Doctors have this way of kind of having power over all of this medical information. So, anyway, when this video popped up, I distinctly felt like I needed to take a swing at reacting to his reaction to it because I'm just so fascinated to see um, kind of his take on everything. So let's see what he has to say about health at every size.
Cosmopolitan UK put this on the cover, and it stirred a lot of controversy.
But let's focus on whether obese people are healthy, because they're not.
I sat down with Arga Gonzalez, a renowned bariatric surgeon and obesity researcher, to get her thoughts on the cover, as well as the popular body positivity movement known as health at every size. Do you think overall a negative or neither?
That very line, healthy at every size, is not actually true. Can there be people?
Okay. Right away, this sets up the debate for me, and it starts it starts in such, I don't know if it's ever intended to be aggressive, but there is something to be said about this definition of health that I think is so abounded. And so I was not surprised that she said this, but I was again taken aback by this basic statement of it's absolutely untrue that you can be healthy at every size. I understand. We'll hear what she has to say about it, but right away, like for anybody watching this who wants to explore this idea, it's kind of a weird shutdown to start off with. So, anyway.
At any size who are healthy at that moment, yes. But is it true that no matter what your size, you're always able to be healthy? Like, that's not true. I am anti weight bias, anti fat phobia, anti fat stigma, definitely anti fat shaming. I've written about that. But I don't think that being aware of the consequences of obesity is the same as fat shaming.
What I'm hearing.
There are a couple terms in this debate that I think are interesting to pay attention to. The difference between health and obesity as terms. Oh, June shaking. The difference between health and obesity. She basically says she lists all of her unbiases. I'm not fat shaming. I'm not fat biased. I'm not all of this stuff. And at the same time, we have these two definitions that seem related. I often want to understand how they are related. So, what is the difference, medically speaking, between obesity and health? If they are the same thing, then we have more problems. But Dr. Mike's going to sum it up for us.
And correct me if I'm wrong, is you could be a patient who is diagnosed with obesity, may have great cholesterol, maybe not diabetic, their blood pressure may be great. The fact that their weight is above a certain cutoff, it puts them at a greater risk down the line, maybe not at this given moment.
All those lab values also don't mean that they don't have knee pain or hip pain or ankle pain or lower back pain, which are all things that we commonly see with people with obesity. Increased risk of endometrial cancer, for example, increased risk of mood disorders. Like, all of that is still there, even if our lab values are normal.
Speaking about the Cosmopolitan cover, do you think that those covers send a right message or wrong message during a time where obesity in the United States and in the world is becoming an epidemic?
Okay, so this gets into the place where I'm so interested, because now they have quickly shifted away from defining the terms and rightly talking about what she has listed as risk factors for a lot of long-term or chronic, potentially fatal health disorders that are linked to being more likely if you are at a certain level of obesity on the scale. So that to me is a medical definition. He right away switches over to what's the messaging. Now, as a sociologist, this is where my ears perk up right away, because messaging and fact of the matter can be very different things. So he is I cut his question off, but he's asking about what is the cover of Cosmopolitan that had Jessamine, oh, I can't remember her last name, but she was the woman pictured on the Cosmo cover, and billed as, healthy at every size. He's asking this doctor, is the messaging right for this time period? I have an opinion. I will hold it until we hear from her.
Epidemic of sorts. With COVID-19, we see worse outcomes for patients who are diagnosed with obesity. Do you think those covers are problematic, basically?
I think they're a little bit misleading. I think that the story itself, like the content that they wrote, is very nice. And they talk about how each of these women, what the relationship with physical activity is and how they feel about their health and their body. And it's not even about obesity at all. There were a number of people criticizing, saying that, well, especially when we know that people with obesity have worse outcomes with COVID, this is irresponsible. And to me, that feels a little bit of a stretch. Like, I think they're just trying to say that people of all different sizes can move, can be physically active, can love their bodies. And I think that's a really good message.
Okay, that went a lot better than I expected. In fact, she kind of frames what I think Cosmopolitan was trying to do exactly correctly, in that it's not a discussion of medical condition, it's a discussion of lifestyle habits. And I think that's what the definition of healthy is. So healthy is defined by your habits, whereas I think it gets confused with the idea of health. And I know this is why I'm so fascinated by it, because these terms are different and they mean different things, but people all like lump them together. So can you be healthy with obesity? Yes, because you can have a lifestyle that supports healthy behaviors. Are you, is your health good if you are obese? Yes, if your biomarkers say that they are. Can you still at the same time be more at risk for dangerous diseases down the line? Yes. So the discussion of obesity as like a what's happening now versus what could happen in the future, I think that distinction is so important. Like, you can choose to live a healthy lifestyle and eat healthy foods, and by that I mean foods that nourish your body and support health, and you can move in those ways and create health that way. And because of this medical condition whereby you are carrying more weight than is uh, recommended, because it increases your risk for a lot of dangerous chronic illness, potentially fatal ones, all of that can be happening at the same time. I think that's the difficulty of this discussion of obesity and health. Somehow we lose the sight of the present day when we talk about obesity specifically. Um, if you're doing healthy things in the service of being a healthy person, then I think that explains that you can be healthy today and still be at increased risk for big scary diseases because you are overweight.
I think they are ultimately sending the message, and I agree with you on that. I just think they're doing it in a cheeky way where they're trying to create inflammatory conversation, or maybe
Oh, for
it's
sure.
productive inflammatory
Yeah, no.
conversation.
Interesting, his use of the word inflammatory conversation. Inflammatory to who? All the people who are overweight are rejoicing to finally see the acknowledgement of these differences on the cover of a fashion magazine that's, supposedly all about women's lives. So inflammatory to him because he has this traditional training that suggests some other conclusion than what's happening. I'm just saying.
No doubt. I mean, they could have said, this is loving your body, or, everybody is worthy, or what, there's a number of different things they could have put on those covers that would have been pretty accurate and indisputable.
We frequently see on the cover of magazines very slender bodies, thin, muscular, six packs, etc. It's led to true cases of disordered eating going up and body dysmorphia. The sort of rebuttal to this is to say, and that's what's happening right now, let's put people of different sizes on magazines, and let's take someone who is diagnosed with obesity and put them on a cover. Is there a chance that that can lead to disordered eating in the opposite direction, of people feeling it's okay for me to be this size, I should continue my lifestyle, not make changes, not think about going for bariatric surgery?
See, this Dr. Mike. Dr. Mike, such a white male who's thin. Is it okay for me to be this size? Well, what if the answer is no? Yes, it's okay for you to be this size today because this is the size you are today. And there are things, and then he says, is it okay to be this size? Maybe I'm not going to talk about lifestyle changes. Maybe I'm not going to think about going to get bariatric surgery. I want to know who he's talking to, first of all. There are so many levels before we get to bariatric surgery. I'm not really sure how we got to that point, which is a pretty severe or mediation for obesity. But who is he talking to, and how is this in some ways helpful? To me, this shows me his lens that he enters into this conversation, which is that all overweightedness is bad, that it inherently needs to be changed as soon as possible, and perhaps at many costs, if not all, obese their entire lives have been shouldering the weight of feeling disordered with no real solutions for their whole lives. And that is a tough way to live. And so to me, it's just so interesting that he kind of reveals his stance on this using these words that are, I don't even know that he would know that they are biased toward a much more traditional Western, particularly like medical school, non nutritional study of obesity as a state of being rather than a medical disorder that could be treated as we treat other medical disorders, right? So we've got a whole bunch of interesting bias in my mind coming out right here that's, I think, subconscious. I don't even think he would stop to think that what he's saying or the way he's saying it is a problem.
Because the celebrities I look up to are this way.
I think there's a balance there. I think that we can have the covers like the Cosmo ones and say, look, people who are a bigger size can still be active and aspire to having a healthy body, versus saying this is how we all are and we should just live with it. I think that's a different message. In this country, about 3/4 of people have overweight or obesity. And if there were no negative health consequences of that, maybe that would be fine.
This might be the best definition of healthy that has come out of this conversation so far. So if we're talking about healthy, maybe what we can say is there are no negative health consequences. That is what healthy is, versus non-health or unhealthy, which would imply that there are negative consequences to that state of being. I think that's very helpful, actually.
But the fact is, as we've talked about, all of that excess weight brings with it risk for very serious problems that are costly to the individual, that inhibit their lifestyles, and make it harder for them to live the life they might want. So I think we have to kind of acknowledge both sides of it, that no, we don't want to be stigmatizing people who are bigger, but we also want to recognize that obesity has a number of medical problems associated.
And I know they're talking about obesity today, but I do also want to mention when he did his rundown of, we know who we see on magazine covers already. They're thin, they're muscular, six-pack abs. No, those are not, number one, those are not high fashion magazines. The magazines that are high fashion typically, certainly more in the past than now, but have shown women who are rail fit, who we know because of their stories are equally as unhealthy as those women who are obese. And yet we don't talk about those women as being unhealthy. From Dr. Mike's standpoint, we're only talking about the ones who are overweight. That to me is where the bias and the stigma starts to happen, because you've got this subconscious acknowledgement that, oh, the women who are skinny have been validated by the people who put them on the covers, so they're okay. We're not talking about underweight people being unhealthy and having unhealthy habits. No, it's just, now I know that this video is about obesity. So it's interesting here. She is actually sticking to a much more scientific, much more, I think, medical focus, where Dr. Mike is really coming from a much more social perspective. I don't even think he knows it, but he is, to me, showing that bias. He's not referring to everyone who isn't a healthy weight. He's assuming that people who are underweight are okay because they're already on the magazine covers, so we don't have to worry about them. No worries about the messages that they may be sending. And he also, I think, wipes away the fact that the people he has described are not on the magazine covers, not all of them, some of them, maybe like health magazines, like, whatever. But if we're talking about fashion and the general magazine cover population, we're not talking about healthy looking people all the time. They are extremely skinny, which is how they get the job of being models who they take pictures of for the covers of magazines. So I'm just saying. Oh,
Associated with it.
The way that someone like you goes about treating individuals who are diagnosed with obesity, or at least morbid obesity, would be through a procedure known as bariatric surgery, right? That is your specialty. You obviously don't think that is recommended for all patients, but it's certainly one of the best treatments out there when it comes from an evidence perspective of not only losing weight, but keeping weight off long term, and then also even getting rid of some other diagnoses like diabetes, like high cholesterol, etc. Why is it that bariatric surgery has better long-term success in keeping the weight off than, let's say, traditional diet and exercise recommendations that your family medicine doctor can give?
because it forces you to completely reduce your calories to an inhuman level. That's just my guess. Let's see what she says.
One thing we know about losing weight with diet and exercise is that only about 5% of people who lose weight that way are able to maintain that weight loss. So all of us know people who've had incredible success with diets and exercise, and that's amazing and something to be really proud of because they've really beaten the odds. For the majority of people, no matter how hard they try, it's very, very hard for them to get to a healthier.
Okay. So here is my question about this. When we think about, again, establishing what healthier means, right? So she says, the majority of people, 3/4 of the people who try weight loss, have a very, very hard time getting to a healthier weight. Okay. Can we understand the root causes of why that is? Maybe she's going to talk about it and I skipped ahead. But to me, yes, there are people who overeat or for some reason are putting too many calories into their body, and it's hard to sustain efforts to not do that. Why? Why is that hard to sustain, especially when you have highly motivated people? Everybody assumes that obese people are not highly motivated to lose this weight. Obesity is one of the most substantial and lasting stigmas in certainly American culture and as the world globalizes global culture. So, why are we assuming people are unmotivated to lose weight? What's behind that? What's the instigation for overeating necessarily? So, she's going to talk about bariatric surgery being the answer because it basically forces your hand on eating very few calories for the rest of your life because it decreases the size of your stomach. I don't know. That seems like a real questionable practice to me. Your body is built in proportion for the function that it's supposed to have. I don't understand how we're like, well, thank God. If we just cut their stomach to a third or a quarter of what it was, they'll absolutely lose that weight and be able to keep it off. What else are you cutting out in terms of functionality? I mean, come on. If you're reducing the size of their stomach, even with a lap band procedure that can be like, undone, whatever, if you're reducing the size of their stomach, are you not also reducing the ability of the stomach to absorb the right amount of nutrients, the right amount of what your body needs nutritionally to sustain itself? I just think this is bonkers. I'll let her finish and then I'll continue to rant.
Weight and size on their own. And that's where bariatric surgery comes in and is really, really helpful. We don't 100% know in terms of the weight loss why it's more effective. We think that it helps reset people's kind of set point, if you will. A lot of us believe that every body wants to be around a certain number in terms of weight or a certain size in terms of BMI. We don't know how, that develops.
Because everybody is exactly the same. How many unknowns is she citing here? We don't know how this works. We don't know why it works. We think maybe that this is science. I'm offended from the standpoint of science.
But that seems to be what happens. One of the most magical things about bariatric surgery is its effect on diabetes.
Serenity now. It has a magical effect on diabetes because you can't possibly eat enough sugar to cause your pancreas to oversecrete insulin. I mean, come on. That is my dog, Jew.
Especially when we talk about specifically the gastric bypass. We have many, many patients who have diabetes, are on insulin, maybe other medications for it, and then they have surgery today, and then today their blood sugar is normal. And they no longer need those medications. So that's really magic.
Absolutely. I mean, anytime you can cure what we consider to be an incurable illness, it's absolutely amazing.
Before they go on, I just want to say this. I don't understand why bariatric surgery becomes the answer for curing insulin problems when we know that dietary interventions will do the exact same thing. We know for a fact that if you cut down carb consumption and sugar consumption, or at least, and I say cut it down, I'm not talking about cutting it out. If you cut it down and you have a normally functioning pancreas and stomach, that your insulin will regulate itself. So why do we need to bypass an entire organ system? I just don't understand. This is why medicine makes me crazy. Why? And here's the other part. And this is where, medicine and the social part of this all rolls together. If you do this, you're talking to people who are desperate because you've told them that there is no other way to exist except in a normal body size. And as long as they're obese, that horrible things will happen to them. And that's aside from just the social stigma that exists, and that's going to happen to them anyway. So you're saying to this population that is literally dying for a solution to this problem, you're saying, we have the answer. Boy, do we have the answer. It's going to fix your whole life. We're going to bypass we're going to reroute your stomach and intestines. You're going to not be able to eat like a normal person for the rest of your life. Your portions are going to look infinitesimal. Well, they're going to look real small compared to everybody else. And we're not even guaranteeing that it's going to help. Instead, we could potentially just tell you to hold off on the carbs and the refined grains and sugars and see how your insulin reacts. This to me is an unacceptable answer. I can't even believe. Obviously, there are people who need the severity of this procedure, this bariatric procedure. I get the idea that if you are hundreds and hundreds of pounds overweight, you've lost all of your mobility, your quality of life is so low that you need an intervention that is going to just do this very quickly, that this is a reasonable thing to think about doing. And no judgment to people who choose to do bariatric surgery, none whatsoever. But my question is, if you said to the same people, you can have this surgery, it's a major surgery, it's not reversible unless you do, like the lap band or whatever, those are not proven to be as effective. As soon as you take those out, people go back to the same weight that they were. We can go ahead and choose to do that, or we can set you up with a therapist who's going to help you to do dietary intervention only, and we're going to set you up with either physical therapist or a trainer who is going to keep you accountable to walking a little bit more and adding more activity into your daily life. And you're going to lose the same amount of weight either way. Some people will choose the surgery, I have no doubt. I bet a whole bunch of people, though, would choose not the surgery. So I'm just...
Talk about the challenges that your patients face, and actually my patients as well, in trying to get bariatric surgery covered from an insurance perspective.
All right. Harumph is what I say to all of that. I'm going to stop there for a minute because I think they have really talked about a lot here. And I've obviously responded to a lot that they didn't even want me to respond to. They're going to get into talking about the insurance issues and all of that. I think, and those are very interesting to me from a system perspective, from the social perspective. Insurance companies are not scientific places. They are going to look for the least risky option and do that. And so naturally, this surgery is very hard to get covered because there are a lot of, obese people are a risky population in a lot of ways. So that's, I feel like, for another day. But this conversation in and of itself has really laid out for me some of the issues that I see in this conversation. You've got these two doctors talking to each other, one who is an obesity specialist who does bariatric surgery. To me, the standout thing is when she says, we're not sure why this works. We're not sure how it works. But we think it's the best answer for anybody who really wants a long-term health solution to solving their obesity. This, to me, it's so not scientific. Like, when we talk about, bringing the receipts and showing the data, she was just basically like, yeah, well, we don't know, but we think it's the best thing. It is frustrating. I fall into this category for sure of people, my own doctor, every time I go in to see him, I ask for particular labs like a fasting insulin test. Instead of doing that, which he always says no to, he will do fasting glucose, but there are limitations to that. Instead of just saying yes and going down that path, he's like, no, we're not going to do that. But I do want you to consider bariatric surgery. It just makes me so frustrated. We say to obese people, you can never be healthy at that size. And when obese people say, okay, I'll change my lifestyle habits and I'll prove that I can move more and that my body is capable of doing this and I can take control of it, and they get put on magazine covers, we are asked whether that sends the right message. And when we do go ahead as obese people and choose to move more and choose to take more ownership and are not seeing results, or are coming to the conclusion that there are other factors that are obviously like dark and ghosty factors that we don't understand, if we go to the doctor for help, the doctor says, well, we're not going to check up on any of those things that you think it might be because it's not that. But I do want you to consider surgery that is going to change your internal makeup and lock you into a medical solution that we think is your best option, even though it will drastically change how you live your life for the rest of your life. But you should want that, right? Because you don't want to stay where you are. I think that's the real issue with that's the catalyst for the movement, the healthy at any size movement. And maybe it is misnamed. I think we can't use the word healthy to imply no risk. And I don't think that is how I it's also difficult because I know some of the advocates of healthy at any size would say they are perfectly happy at all sizes or perfectly healthy. I think they can say you can be totally happy at all sizes. You can have body acceptance at all sizes, but you cannot deny that there are risks, more risks associated with larger, heavier bodies. There just are. And if you don't clamp down on some of that stuff, you get runaway diseases related to nutrition and overweightedness. So it is a sticky wicket. And this is this is well beyond my 40s for sure. I have dealt with this issue since I was a very small child. And so I've got a long history of dealing with this discussion. But I know for a lot of, and I feel for a lot of women, especially because I think women have a harder time of it. But I feel for women who have been regular sizes their whole life, and then all of a sudden they hit 40 and they put on pounds. They can't stop it. It's like a runaway train. I'm like, girl, I know that train. I've been living on that train. And immediately they're bombarded with these messages of you're sick, it's dangerous to you, your life is never going to be happy. And we need to get you into that surgery to fix it. And I just feel terrible that women have to endure that message, and even this discussion, and men too, but men have a very different experience of this, I think. Although I think all people who are considered fat by society experience a stigma for sure. No matter who they are, no matter what age, gender, race, it doesn't matter. I think there is a stigma, and there is discrimination, there's systemic bias against that. So I wanted to look at this conversation just to kind of, I don't know, see what happens when doctors put their heads together and have this conversation. And I have to say, Dr. Mike, oh, I'm a little disappointed. A little bit. I know he redeems himself a little bit later on, so I'm going to not worry too much about it. But anyway, this is a conversation I just can't get enough of. So if you've managed to watch this far, thanks for watching. Feel free to argue with me in the comments if you'd like. I have plenty to say about the issue. I know this is not the perfect or most comprehensive video, but I did want to do a reaction to this conversation just in the moment to kind of have my say. So anyway, that's it for now. Stay tuned for the next one.
Infinitesimal.